So welcome to today's session. We are looking in IRH on cancer of the cervix. We'll go straight to read through the scenario for today. The scenario says Mrs. Tembo, a 60-year-old widow, is admitted to gynecology ward with history of leukorrhea and a diagnosis of cancer of the cervix has been confirmed. She is scheduled for radical abdominal hysterectomy. A outline the 5 stages of cancer of the cervix. B, state 5 signs and symptoms of cancer of the cervix other than the one mentioned in the stem. C, describe the post-operative management of Mrs. Tembo in the first 72 hours. D, state 5 preventive measures of cancer of the cervix. And this is coming, of course, from the November 2023 past paper. We'll go straight to look at the definition in case we are asked to define cervical cancer. So we can define cancer of the cervix as this is the abnormal and uncontrolled growth of malignant cells in the cervix caused by human papillomavirus, characterized by back pain, heavy vaginal bleeding, and weight loss. So in cases where we are asked to define cancer of the cervix, this is how it can be defined. Now going back to question A, which said outline the 5 stages of cancer of the cervix. The first stage, of course, it is stage 0, and this is where we talk about the carcinoma in situ. So when we say the carcinoma is in situ, it means that it is still in its original place. The abnormal cells are only found in the innermost of the cervix, and these cells have the potential to become cancerous but have not invaded into the deeper tissue layers yet. So this particular stage is highly curable, and we can easily detect someone who's on this stage by using a pap smear, and that is why cervical cancer screening is important, because noticing it at this stage, treatment is there and very curable. The next stage is stage 1, and stage 1, this is where cancer is confined to the cervix. So the cancer grows from the inner surface layers into the deeper tissues of the cervix, but does not spread beyond the uterus itself. So the cancer at this stage is still very small, and it can only be seen under the microscope. And when we talk about the prognosis or the outcome of stage 1 cervical cancer, the prognosis is very good, and treatment may involve options like surgery, where radical mastectomy is done, and of course, some women who may still want to preserve fertility, radical trachelectomy can still be done so that we preserve the uterus. So that is about stage 1. The third stage is stage 2. Remember, we start from stage 0, 1, 2, 2. So stage 2 actually is the third stage. So stage 3, this is where the cancer has spread beyond the uterus, but not to the pelvic wall or the lower part of the vagina. So on this phase, the cancer starts to extend outside its original place, which is the cervix, and the uterus into the nearby tissues. And it may involve the 2/3 of the vagina, where the tumor may even have a size of about 4 centimeters or even smaller, a bit smaller. Treatment at this particular stage may involve a combination of radiotherapy as well as chemotherapy, and sometimes surgery may be given as an option, and prognosis is good but not as perfect as the way it is in stage 0 or stage 1. The fourth stage, which is stage 3, this is where cancer has spread to the lower part of the vagina and the pelvic wall. And the cancer at this particular stage, it is now more extensive within the pelvis. The cancer spreads to the lower third of the vagina. At the same time, the cancer also spreads to the pelvic wall. It may block one or both ureters as well, and this may cause kidney problems. Apart from that, the cancer may also spread to nearby lymph nodes in the pelvis. So at stage 3, of cervical cancer, it is slowly affecting nearby adjacent organs or tissues. When we talk about treatment at stage 3, it mostly always involves use of chemoradiation. So chemotherapy and radiation therapy may be combined or done to such a patient just to control the cancer and also relieve the symptoms. The prognosis in this particular stage, which is stage 3, it is more guarded, it is more not so specific as compared to the other stages, but treatment can still be effective but not assured. The last stage is stage 4, and this is the most advanced stage where the cancer has spread to other parts of the body, and the cancer spreads to nearby organs such as the bladder and the rectum. The cancer may also spread to distant organs beyond the pelvis itself, like the lungs, the liver, also the bones. With stage 4, it is mostly considered not curable, but it is treatable. So the focus is usually a shift from controlling the cancer's growth to relieving symptoms and maintaining quality of life. So with treatment, it may still include radiation option in specific areas, chemotherapy, targeted therapy, as well as immunotherapy. So the cancer may not be curable completely, but treatment may be initiated just try to control the symptoms, the growth of the cancer, and just promoting or maintaining the quality of life of the patient. So when we talk about the 5 stages of cervical cancer, these are the stages that you can talk about. Question B says 5 signs and symptoms of cancer of the cervix other than the one mentioned in the stem. Among the symptoms, back pain is seen because of metastasis of the cancer itself, which ends up damaging the tissue and also the cells of the cervix as well as the pelvis. Fatigue, this is due to anorexia that is seen, which affects energy levels in the body, which causes the patient to experience generalized body weakness. And this is because also the cancerous cells utilizes more of the energy because there's increased metabolic, which depletes the energy levels in the body because the body is directly focused on producing a lot of immature cancerous cells. Heavy bleeding from the vagina because of damage of the cells of the vagina and the uterus itself. Hence, we see continuous bleeding. Leaking of urine or feces due to fistula formation as a result of the presence of the cancerous cells. Loss of appetite and weight loss because of the anorexia that the patient experiences. Pelvic pain is seen because of metastasis of the cancerous cells to other organs. So these and many other symptoms are still seen, inclusive of vaginal bleeding and of course bleeding after coitus and others. Question C says, describe the post-operative management of Mrs. Tembo in the first 72 hours. Of course, this is the outline that you use, and these are the details going together with that outline. Of course, start with the aims, talk about patient collection, talk about the environment after you have collected the patient, talk about promoting a patent airway, talk about promoting adequate breathing, talk about promoting adequate circulation. So we talk about these 3 headings because the patient may be under the influence of general anesthesia. Hence, these 3 headings apply. From there, we talk about care of drainage tubes because the patient may come with specific draining tubes important for the recovery. From there, talk about observations and interventions that you are putting on observations. Talk about pain management. The patient may have incisional pain. From there, talk about psychological care and talk about nutrition, of course. Talk about wound care, exercise, hygiene itself, and of course, finally, elimination. So this is the post-operative care that you can apply on this particular scenario question. The last question says, state 5 preventive measures of cancer of the cervix. The first preventive measure is, of course, HPV vaccination. And this is the primary preventive measure where we vaccinate especially women of reproductive age group against high-risk human papilloma virus. And this may at least prevent contraction of cervical cancer. The other preventive measure is the regular cervical cancer screening, where we do a pap smear test. So by doing a regular cancer screening test, this may easily detect precancerous changes in the cervix before it even manifests. And the pap test itself involves collecting the cells from the cervix just to examine them for abnormalities. And this helps starting treatment early, even before the cancer itself develops. Hence, a pap smear test this can easily help and be utilized as a preventive measure. We can also use HPV DNA testing, and this testing tries to identify the presence of high-risk HPV strains in the cervical cells, and it can be used as a primary screening tool or in conjunction with a pap test for women, especially over the age of 30 years. And this helps detect the risk in these particular women and initiate treatment even before cancer is seen. Others is practicing safe sex, for example, correct use of a condom, because we know to say the human papilloma virus may still be harbored in men, especially who are not circumcised, because the foreskin may still be able to harbor dirty, inclusive of microorganisms like cancerous cells. Cancerous waste, of course, that may be harboring the HPV. So hence, correct use of a condom or such practices of safe sex can easily prevent or limit transmission of the HPV between the male partner and the female partner. Avoiding smoking. Smoking significantly reduces cervical cancer because the chemicals in the tobacco easily damages the DNA of the cervical cells and also weakens the immune system, making the body find it difficult to fight the HPV infection. Hence, smoking cessation or stopping smoking is very crucial in preventing also most type of cancers, including cervical cancer. Also, health education and awareness can be used where public campaigns educate women and communities about the risk factors, symptoms, and also critical importance of vaccination and screening in terms of prevention, so that as many women as possible may accept to be screened rather than seeing it as something that is infringing on their privacy or right. But if most women understand the importance of it, they may participate in the activity. Thereby, in long run, you may have a lot of women screened, those identified to be at risk treated, and preventing outbreaks of cervical cancer. Many other preventive measures can be utilized, inclusive of circumcision, of course, for many, since they may be the primary order of the HPV virus. Hence, if most men are circumcised, we may also tend to reduce chances of spread of cervical cancer itself. So that is all about the question for cervical cancer that we are looking at for today. Till next time, goodbye.